Which comes first, the stimulants or the oxybate? I'm Dr. Alcibiades Rodriguez from the NYU Grossman School of Medicine with my colleague Matt Davis.
Hi, I'm Matt Davis. I'm a neurologist and sleep specialist. I'm in solo practice in New Jersey.
Hi, so the question is for idiopathic hypersomnia, right? Matt, the issue we have with this rare disease is which will be the number one, number two choices. Sometimes we deal that with the patient. Sometimes we talk in meetings, in conversations. So what is your approach for this type of patient?
Yeah, it's a tough one, and I think I look at this kind of from two windows here. Both logistically, but also clinically, and what's proven and what's approved. Because logistically, when I make a diagnosis like this, and you see the same thing, I know that this is a real revelation for patients. It's almost a weight off that this is a legitimate, real neurologic syndrome they don't have control over. So my point is, I want to treat this. I want to give them a plan as they're leaving my office on that day. I give them the results of the test. So we have options like the low sodium oxybate that is FDA approved for adults with IH. But we know there is a process of getting that medicine. We know there's an approval process. They can't just go to their pharmacy to get it. So my approach usually actually is to start with a generic wake promoting agent, usually modafinil, to start with, because I know they can go to their pharmacy, get it, they can start it within days, and then see how they respond, and then potentially add in the low sodium oxybate, or replace or use some combination therapy, which we all know is often the best treatment anyway. But it's almost a logistical question more than a clinical question in my mind, because I want them to have something to start with relatively soon. And we know something like modafinil can help.
That's a great point. In my case, I'm a little bit different. So before, because there is some small studies with modafinil treating excessive daytime sleepiness at young age, that was my approach. And because the insurance probably will not cover other indications, right? It will cover the generics. Now we have the low sodium mixed salts oxybate that it has the largest study in idiopathic hypersomnia, showing not only improvement of the Epworth sleepiness scale, but other areas too, like the sleep inertia and some also the memory and concentration issues that they may have. So I'm changing a little bit, and the oxybate seems to be this low salt, mixed salt oxybate seems to be my first choice since the insurance is approving them. But it's an issue about urgency or feasibility to treat them first with the other generics or other wake-promoting agents. I will do that too.
Let me ask you a question then. So in these patients, do you find that and I agree that the low sodium oxybate is potentially the best first option in theory. Certainly the data is excellent. Do you find that bringing that possibility up to patients on that initial kind of results visit, here we're going to initiate therapy, are patients hesitant? Do they feel like they're ready to go down that road? Do they feel like they need time to research it a little bit? Because that's the other barrier sometimes, is that it's a very effective medicine, but it's a serious medicine, and
right.
Sometimes patients need a minute to think about it.
That's correct. I usually explain them very well. I usually give you a brochure, and then we had the discussion. Sometimes they decided right away. Sometimes they tell me they need to wait. Yeah. As you remember, all those patients usually takes years to get there. I don't mind to wait a little bit more.
That's a fair point. The window to diagnosis is so long that maybe right. Maybe taking a week or two to have them help them make a decision is.
But going even further to clarify the point to our audience is that most of these patients, my experience is, even with oxybate or any type of wake promoting agent or stimulant, they may need something else. Usually they may need 2 medications, and some of them even may need 3. So it's no right or wrong to start the wake promoting agent or the stimulant versus the oxybate, and maybe add something else later on, right?
Yeah, totally agree. I mean, I think it's fairly clear that the standard of care is to consider combination treatments with these patients, and using low sodium oxybate and a stimulant or wake promoting agent in the morning is a standard treatment. And so it's which one starts first is one question, but often they are used well together. So I agree with that completely.
And with that, we can say that we need to individualize every patient. Every patient is different, their needs, what they expect, right? And it's not right or wrong. It's just the best practice that is good for your patient. Correct?
Agreed. Yep, agreed.
Thank you.
Thank you.